So let's talk a little bit about what Medicare has done for us this year by authorizing this code. This CPT code is 60660, and that allows for ablation of one thyroid nodule. And there is a second code, actually, 60661, and that allows for ablation of a second thyroid nodule on the same day. So the fact that this is available to Medicare subscribers is wonderful because wherever Medicare goes, all these other payers, they eventually go, and that means that all these people who couldn't access the procedure because it was a cash pay procedure are now going to have access for what's basically a copay. All right. And that's going to help significantly the burden of being able to get this done. It gives people so much more choice in deciding how they want to manage their thyroid nodules and be able to retain normal functioning thyroid tissue and not have to take pills. I would love to not have to take pills for my thyroid. So let's talk about how you would go about getting a procedure done with this code. So in our practice anyway, since we contract directly with Medicare, then we would handle finding out coverage and whether there's deductible applied to that, whatever, and maybe there's a copay to be done. And then when we're done with the procedure, we bill Medicare directly for that, and they pay us. In our practice, the only other thing that we do is contract with patients directly. So folks that have Blue Cross or Aetna or whatever, we contract with the patient. And so in those cases, patients can call their insurance and find out, is this code 60660 covered? And if so, is there a deductible? Is there a copay and whatever? Does there need to be an authorization or something? And when we're done with that procedure with the patient, then we give the patient all of the paperwork they might need to submit to get reimbursed directly from their insurance company. And we give people instructions on how to do that too, because it can be a little bit tricky. So now that we have the code, now that this procedure is way more accessible, let's talk about who should have the procedure. And not everybody's a good candidate for it, right? An ideal candidate would have a benign thyroid nodule that is at least 1.5, ideally 2 centimeters in size. And certainly we can treat in one treatment nodules that are up to 3.5 or 4 centimeters in size. When they get bigger than that, they usually need more than one treatment. A patient who's a good candidate for RFA would be able to lie on the table with their neck extended for the total duration of the procedure, which can be up to an hour altogether. They should not be on any blood thinners, or at least be able to come off of blood thinners safely for a short period to be able to have the procedure. People who have pacemakers or defibrillators should not have this procedure. And people who are pregnant should not have this procedure. We don't have data about the safety of this procedure for pregnant people. But other than that, if we meet all those checkboxes, then it's a viable way to treat large thyroid nodules that we know are benign. Shrink them down, keep your thyroid function. Accessibility, it's America. Accessibility is always a problem, right? For a Medicare beneficiary, the access for reimbursement and coverage and all that kind of stuff, it should be a slam dunk. Again, this code was just approved on January 1st of 2025. So we, of course, are all working through the processes here. But from our initial research in the coding and billing guides, it looks to be pretty straightforward. And all of the usual office copays and deductibles would apply to that. For people who have private insurance, things are always a little bit more complicated because every one of these companies kind of has its own set of rules. So once you know that you have approval for a code, then we would go on with the procedure. And we would provide you with all of the paperwork that you would need to be able to go back to your insurance and say, here's my billing, give me a check for this procedure that you cover. And it's really important for all of these payers to know that patients demand this for themselves. They demand the ability to choose minimally invasive procedures with excellent long-term outcomes and very low risks of complications, instead of having to choose surgery for reducing pressure symptoms of a thyroid nodule. And it's important that people are constantly advocating for themselves so that they can get good coverage, because every insurance company is going to update their code access to different procedures every year, sometimes multiple times a year. So squeaky wheels get the oil. So let's just recap everything that we've heard here. We've got the new code from Medicare for radiofrequency ablation of thyroid nodules. That's a well understood, lots of long-term data on how effective this treatment is. It's minimally invasive. It shrinks nodules 50 to 80% in volume. Lots of people are good candidates for this. It happens in the office. It's kind of like getting a cavity filled at the dentist, not so bad. And the effects are good, and patients have been happy with being able to choose to preserve their thyroid function. And we're so thrilled that a code has come through that is going to provide this access to more and more and more Americans that deserve to take minimally invasive strategies first and only opt for more drastic strategies like total thyroidectomy or hemithyroidectomy if the minimally invasive things don't get the results that they're hoping for.